Welcome back to The World Tonight. Let's talk about glaucoma. It is the leading cause of blindness for most black people here in America. And this is important. According to one of the country's top ophthalmologists, prevention is not only key, it's relatively simple. Dr. Daniel Laroche, a glaucoma specialist in New York, has his own practice and also works with Mount Sinai Medical Center. Dr. Laroche, a lot of people these days don't even realize they have glaucoma until they've suffered quite a bit of damage in their eyes. Can you explain why that happens?
Yes, thanks for having me. Glaucoma is known as a silent thief of sight. When you touch your eye, the eye has a pressure. The normal eye pressure is 15. With age, the eye pressure can go up in some people. And when it goes up to 18 or higher, it does damage to the optic nerve, which is the nerve that connects the eye to the brain, that can lead to loss of peripheral vision. And it does so silently. You don't even feel it. And you can lose nearly 90% of your vision in one eye because you're using your other eye before you even notice it. So it's very important to get your eyes examined to get checked for glaucoma, cataract, retinopathy to make sure everything is okay.
Doc, I literally spoke to someone this morning, early morning, who stated that over a series of days he could not see in traffic, and he was driving, and he had a near, miraculously he was not killed in an accident because he could no longer see the car because of the sunlight blinding him, and he couldn't see, and he discovered later on that he had cataracts. Is that related to glaucoma? And as you know, glaucoma among African Americans is 4 times higher than in white communities. This gentleman was black, and the rate of going blind from it, it's about 10 times higher. So those are alarming statistics, and that is an alarming story that I just heard this morning. Why is our community more at risk for glaucoma and cataracts?
Okay, there's two major reasons for that. One, there's a shortage of black eye doctors in black communities across America. We have 40 million African Americans in the United States. There are only 400 black ophthalmologists in America. Our communities are extremely underserved. We need to train more black eye surgeons to help meet the needs of our community. That's one. Two, by the time many of our patients present to the office, they often present with pretty advanced disease. And so when they're presenting with that much of advanced disease, we have to do earlier surgery in patients. Specifically earlier cataract surgery, because the enlarged lens is the most identifiable cause of glaucoma in the community, leading to either narrow angle glaucoma or open angle glaucoma with pigment liberation rubbing off against the iris, blocking the drain. So by taking the cataract out early on, you lower the eye pressure by about 5 points. And we have new techniques of microinvasive glaucoma surgery with a device like this, with a small needle-like tip, that the time of cataract surgery, we open up the drain inside the eye. This is an outpatient procedure that takes about 15 to 20 minutes. You go home the same day, lowers the eye pressure dramatically. We've published papers that 60 to 80% of the time you can get people off of eye drops if you catch it early enough. So those are the two things that we need to do to help make sure and reduce the risk of blindness from glaucoma, in addition to making sure everybody gets their eyes checked regularly once a year.
And that is the key. I've got about a minute left, Doctor. Getting regular eye exam sounds easy enough, but for some reason, a lot of people, particularly in the black community, are not doing that. Is there a way to increase the access in order to get good quality eye care for the money to pay for it? What do you do? What do you suggest?
Well, okay. First of all, if you're employed, try to get health insurance through your employer, or ask your employer to help cover the medical expenses. If you're not employed or you can't get it through your job, try to apply for Medicaid and see if you can get Medicaid. If you can't get Medicaid, the American Academy of Ophthalmology has an Eye Care America program, where if you ask and you let them know that you don't have insurance, they will get one of their 26,000 board-certified ophthalmologists to be able to do an eye exam for you locally in your community free of charge. So there is a way you can do it. Those are 3 different ways that you can do it to access care. Very important.
I appreciate you so much for coming on and sharing these insights and this perspective and knowledge about what really has to happen in order for us to protect our eyesight in the black community. Dr. Daniel Laroche, thank you for educating us on glaucoma and why, as black Americans, we really need to be paying more attention to preventing the loss of sight We're looking forward to bringing you back in our next half hour to talk about your book, How to Be a Successful Black Man. Thank you.